Today we're going to be talking about the muscles of the arm. But before we actually start doing the muscles of the arm, it's important to know which part of the upper limb is the arm. As opposed to our common everyday use of the word arm, where we refer to the whole of this upper limb as arm, when we're talking about the arm anatomically, the arm is the part between the shoulder joint and the elbow joint. So this part here is the arm, this is the forearm, and then you have the hand here. So today we're going to be talking about the various muscles which are present within this region known as the arm. Before we talk about the various muscles of the arm, it's important to know that the arm is divided into two compartments, an anterior or flexor compartment and a posterior or extensor compartment, by the presence of the various septa of the deep fascia of the arm. Now we've talked about the deep fascia before when we're doing the pectoral regions, and when we were talking about the shoulder joint and the various muscles around the joint, the scapulohumeral muscles and the axiopendicular muscles. We talked a bit about the deep fascia there. So when we talk about deep fascia, we know that when we go from superficial to deep, the superficial most layer is of the skin, the dermis, and then you have a superficial fascia and then deep fascia. Now deep fascia is named according to the region where it is present. So you have the pectoral fascia, you can have cervical fascia, and in the arm, the deep fascia is known as the brachial fascia. So this diagram here shows the deep fascia here in the arm is known as the brachial fascia. Now this is like a sleeve which is enveloping the arm all around it, and it is also continuous with the fascias, the pectoral fascia, the deltoid fascia here, the axillary fascia in the axilla, and posteriorly with the infraspinous fascia as well. So this sleeve-like covering in the arm, which is deep to the superficial fascia, is known as the brachial fascia. Now this brachial fascia is responsible for dividing the arm into two compartments. So as you can see here, again the blue line represents the skin, and then the red line represents the superficial fascia, and the black color represents the deep fascia. So this is the brachial fascia encircling the arm. And then the division of the arm into the anterior or flexor compartment and the posterior or extensor compartment is by extensions of the deep fascia inwards towards the humerus. So this in the center of the arm is the humerus, right? So that is the only bone in this region. So deep fascia has extensions going from the going to the humerus on either side of the humerus, and thereby dividing this region into an anterior and a posterior compartment. On the lateral side, this intermuscular septum is known as the lateral intermuscular septum, and on the medial side, this is known as the medial intermuscular septum. Now depending on what level the cross section is taken from, you will see the presence of various muscles, which I'll show you shortly. But the anterior compartment contains the flexor muscles, and the posterior compartment contains the extensor muscles. Now the flexor muscles in case of the arm are the Biceps Brachii, the Brachialis, and the Coracobrachialis Muscle, and in the posterior compartment the main extensor is the triceps. And along with that you also have the Anconeus, which is a small muscle. Now this is a very simplified diagram because it does not actually show you the various muscles which are present, and it's just to show you how the arm is divided into an anterior and a posterior compartment. So here you can see cross sections at various levels of the arm, and depending on what level the cross section has been taken from, you can see various muscles. So in the upper part you will see the Coracobrachialis, but you will not be able to see it in the lower cross sections. But you can see that this is the lateral intermuscular septum, and then this would be the medial intermuscular septum. Then you have the biceps brachii muscle, you have the brachialis, and then you have the three heads of the triceps here. Okay, so when it comes to the flexors of the arm, you have three muscles: the biceps brachii, the brachialis, and the coracobrachialis. And when it comes to the extensor compartment, you have the triceps brachii, which is the main extensor, and then you have the Anconeus. So here you can see the biceps brachii. Now, as the name indicates, the bi in biceps stands for the two heads. So proximally, the biceps has two heads, and then they join together, and there's a common tendon which then inserts. So it has the biceps brachii has a short head and a long head. Now here you can see the short head of the biceps brachii, which originates from the coracoid process of the scapula. And here you can see the long head of the biceps brachii. Now this long head of the biceps brachii actually originates from the supraglenoid tubercle of the scapula. So if you see here, this is the shoulder joint. It has been opened up, and this is a lateral view. So you're looking at the glenoid cavity here from the side, okay? And this is the acromion, and this is the coracoid process. So this here so this is the glenoid cavity, and just above that you have the supraglenoid tubercle, and from here you have the origin of the long head of the tendon of the biceps brachii. And you can also see here that you can't see the origin of the long head from here, but once this long head originates from the supraglenoid tubercle, it passes superior to the shoulder joint and then through the bicipital groove of the humerus. We've talked about the bicipital groove of the humerus. So this tendon then travels within this groove, as you can see in this diagram. So as the tendon of the long head of the biceps brachii travels within the bicipital groove of the humerus, there is a ligament which connects the two, the lesser and the greater tubercle of the humerus. So it extends between these two tubercles, and this is known as the transverse humeral ligament. So this covers the two tubercles of the humerus, and this bicipital groove within which the long head of the biceps brachii is traveling is turned into a tunnel by the presence of this ligament. And so the long head of the biceps travels within this groove, and here it is covered by the transverse humeral ligament, and from there, and it is also covered by a synovial sheath, and so it travels down here. So coming back to this diagram again, the two heads, you have the long head and then you have the short head. The long head comes from the supraglenoid tubercle of the scapula, and the short head comes from the coracoid process of the scapula. And then there is, this whole is the unified biceps brachii, and then you have the insertion. Now you can't see it here, but the tendon of the biceps brachii is inserted into the tuberosity of the radius. So you can see it better in this view. This is the radius. Now these are the bones of the forearm, which we'll talk about in detail later. But on the lateral side, you have a bone known as the radius, and this here is the medial bone, which is the ulna. So on the radius there is a tuberosity known as the radial tuberosity, and here you can see the insertion of the biceps brachii. So this is the main insertion of the biceps brachii into the radial tuberosity. But a part of this tendon of the biceps brachii also becomes aponeurotic. Okay, so aponeurotic aponeurosis of the biceps brachii then gets inserted into the deep fascia of the forearm. So this aponeurosis, now what is an aponeurosis? It's this is a triangular membranous band in this case. So the tendon becomes membranous and it fans out a bit, and this here is known as the bicipital aponeurosis, and then this bicipital aponeurosis gets inserted into the deep fascia of the forearm. Now this bicipital aponeurosis provides protection to the structures which are present within this area, and this part is known as the cubital fossa. Okay, we'll talk about it in detail later on. So there are various neurovascular bundles traveling through this part known as the cubital fossa, and the bicipital aponeurosis provides protection to these underlying structures. So the biceps brachii is supplied by the musculocutaneous nerve. Here you can see the musculocutaneous nerve. It's coming from here. It pierces this muscle known as the Coracobrachialis muscle, and then it also supplies the biceps brachii as well as the Brachialis muscle. Okay, before we go any further and talk about the actions of the biceps brachii, it's important for you to know what pronation and supination is. Now this is when your forearm is supine, it is in this position, and this is your prone forearm. So I don't know how well you can see it here, but I'll try to make it clear. So this is the position of the forearm when it is prone, and this is the position of the forearm when it is supine. Okay, so the biceps brachii, it's a three-joint muscle, which means that it performs its action on the shoulder joint, the elbow joint, as well as the radio-ulnar joint. So the radio-ulnar joint is a joint in the forearm which is between the radius and the ulna here. And I just told you about pronation and supination. So this movement of pronation and supination occurs at these radio-ulnar joint. So you have a superior radio-ulnar joint and an inferior radio-ulnar joint. But for now, it's important to know that supination and pronation takes place at these radio-ulnar joints. So the biceps brachii, when it comes to the action of the biceps brachii, it is a three-joint muscle, as we just talked about. It acts on the shoulder joint, the elbow joint, and the radio-ulnar joint. Now, the main action of the biceps brachii is that it brings about flexion at the elbow joint, but only when the arm is supinated. Okay, so the action of the biceps brachii is dependent upon the position of the forearm. Okay, and if the forearm is supinated, it is a strong flexor at the elbow joint here. But if the forearm is in a prone position, then it is a strong supinator of the forearm. So it brings about supination as well as flexion. So the supination is going to be at the radio-ulnar joints and the flexion is going to be at the elbow joint. So depending on whether the forearm is supinated or prone, the action of the biceps brachii varies. Okay, so in the prone position of the forearm, the biceps brachii is going to be a strong supinator, and when the arm is already supine, then it mainly acts as a flexor at the elbow joint. Now the short head of the biceps brachii also prevents the inferior dislocation of the shoulder. So let's go over the actions of the biceps brachii. When the elbow is extended, it is a flexor at the elbow joint, of course. When the elbow is 90 degrees flexed and supine, then it is the most efficient and the strongest flexor against resistance. And when the forearm is pronated, then it is primarily responsible for the supination of the forearm. And at this point, it is not responsible for bringing about any flexion. So when the forearm is prone, the biceps brachii brings about supination of the forearm. In a semi-prone state, which means half prone and half supine, the flexion occurs only against resistance. Okay, after that lengthy discussion on the biceps brachii, now let's move on to the brachialis. This is the other flexor in the anterior or flexor compartment of the arm, and this originates, now here you can see the brachialis muscle. This originates from the anterior surface of the distal half of the humerus. So here you can see all this part in red shows you the origin of the brachialis muscle. And here in blue you can see the insertion of the brachialis muscle. Now this is the anterior view of the humerus, and this is the ulna. Okay, so here is the insertion of the brachialis muscle in blue, and this part is the coronoid process and tuberosity of the ulna. So here you can see this is the brachialis muscle originating from the anterior surface of the lower half of the humerus, and this is the brachialis being innervated by the musculocutaneous nerve, and this is the insertion of the brachialis muscle into the tuberosity. This you can see is the tuberosity of the ulna. So it gets inserted into the coronoid process, which is hidden here behind this muscle, and the tuberosity of the ulna. When it comes to the nerve supply of the brachialis muscle, it is supplied by both the musculocutaneous nerve as well as the radial nerve. When it comes to the action of the brachialis muscle, the brachialis is the primary flexor of the forearm. Okay, and it produces flexion at the elbow joint irrespective of pronation or supination of the forearm, as well as the presence or absence of resistance. So it does not really matter if your forearm is prone or supine. It does not matter if you have applied resistance or not. Brachialis brings about flexion at the elbow joint, as opposed to the biceps brachii, which either brings about supination at the radioulnar joint or flexion at the elbow joint, depending on the pronation or supination of the forearm. The brachialis brings about flexion irrespective of pronation and supination. Okay, so the third muscle in the flexor compartment is the coracobrachialis. Now here you can see the coracobrachialis muscle. This is not the coracobrachialis, this is the short head of the biceps brachii, which has been cut off. So both of these, the short head of biceps brachii and the coracobrachialis, they originate from the coracoid process of the scapula. Okay, so this here is the coracobrachialis muscle. So it originates from the coracoid process of the scapula. Moving on to the anterior view of the humerus here, as well as the scapula. The red parts show the origins of various muscles. So this red color at the tip of the coracoid process represents the origin of both the coracobrachialis and the biceps brachii, the short head of the biceps brachii muscle. So the coracobrachialis originates from the tip of the coracoid process of the scapula here, and the insertion is here into the medial aspect of the shaft of the humerus. So this blue color represents the insertion of the Coracobrachialis muscle. So here you can see both the short head of the biceps brachii and the Coracobrachialis muscle. So both of them are taking their origin from the coracoid process, the tip of the coracoid process of the scapula. And this Coracobrachialis then goes and gets inserted into the middle of the shaft of the humerus on its medial aspect. So the Coracobrachialis is pierced by the musculocutaneous nerve as it enters into this flexor compartment, and along with the other flexors, the Coracobrachialis is also supplied by the musculocutaneous nerve. So when it comes to the action of the Coracobrachialis, the actions are that it flexes and adducts the arm at the shoulder joint. Along with the deltoid and the triceps, it protects the shoulder joint from inferior dislocation, and hence it acts as a shunt muscle. Moving on to the posterior or the extensor compartment of the arm, you have two muscles, the Triceps Brachii and the Anconeus. So here you can see the Triceps Brachii. Now the triceps, as is evident from its name, has three heads. Tri stands for three, so you have three heads of the triceps. This here is the long head, and you have the lateral head, and then you also have a medial head. And then the other muscle in the posterior compartment or the extensor compartment is the Anconeus, which you can see here. So it's a small triangular muscle which assists the triceps in bringing about extension at the elbow joint. Okay, so talking about the Triceps Brachii, it has three heads and it is a primary extensor of the forearm. Now the Triceps Brachii acts at two joints, which are the shoulder joint and the elbow joint. Now it has three heads. It has a long head, a medial head and a lateral head. So you can see the long head of the Triceps Brachii muscle originates from the infraglenoid tubercle. Okay, so here in red you can see this is the glenoid cavity. So infraglenoid tubercle gives origin to the long head of Triceps Brachii muscle. Then you have a lateral head of the Triceps Brachii, and this originates from an oblique ridge on the posterior surface of the humerus here, which is superior to the radial groove. There's a groove here on the posterior aspect of the humerus which is known as the radial groove, and superior to that there is an oblique ridge which gives origin to the lateral head of the Triceps Brachii muscle, which you can see here in red. And then the medial head of the Triceps Brachii, here in red you can see all of that. It originates from the posterior surface of the humerus inferior to this radial groove, right? So superior to the radial groove there is an oblique ridge which gives origin to the lateral head, and inferior to this groove the posterior surface of the shaft of the humerus gives origin to the medial head of the Triceps Brachii muscle. Insertion of the Triceps Brachii you can see here in blue. So it gets inserted into the proximal end of the olecranon process of the ulna. I just told you there are two bones in the forearm, the radius and the ulna. So this is the radius and this is the ulna here, and this part of the ulna is known as the olecranon process of the ulna. And in the proximal end of this olecranon process of the ulna you have insertion of the Triceps Brachii. Along with that, it also gets inserted into the fascia of the forearm. So here you can see the long head of the Triceps Brachii coming from the infraglenoid tubercle. This is the lateral head of the triceps, which comes from an oblique ridge which is superior to the radial groove on the posterior aspect of the humerus. And then you also have a medial head. So here you can see this here is the origin of the medial head of the Triceps Brachii. You can see the lateral head has been cut off because it lies on top of the medial head in this part. So if you cut away the lateral head of the triceps brachii, underneath you can see the medial head of the triceps brachii, which takes its origin from the posterior surface of the shaft of the humerus below the radial groove. Okay, so when it comes to the nerve supply, the triceps brachii is supplied by radial nerve, and the action of the triceps is, as a whole, you say that it's an extensor of the forearm. It brings about extension at the elbow joint. But if we talk about the three heads separately, the medial head of the triceps brachii is the workhorse of extension at the elbow joint. The lateral head is the strongest, but it only acts when the extension is against resistance. And the long head brings about a weak adduction and extension at the shoulder joint. It also prevents inferior dislocation of the shoulder joint. So because the long head of the triceps is also crossing the shoulder joint, it brings about the action that it brings about is at the shoulder joint. So it brings about adduction and extension here of the arm. But the other two heads do not cross the shoulder joint. They take their origin from the shaft of the humerus and they only cross the elbow joint. So they bring about extension at the elbow joint. The main bulk of the action is done by the medial head, and the lateral head, although is stronger than the medial head, it's strongest, but it only acts in the presence of resistance. One more thing to remember is that just proximal to the insertion of the triceps, there is a bursa. So distal attachment of the triceps is on the olecranon process. Underneath the tendinous insertion, just proximal to that, there is a bursa which is responsible for reducing friction, and this is known as the subtendinous olecranon bursa. The second muscle in the extensor compartment is the Anconeus. It's a small triangular muscle. It takes its origin here from the just posterior to the lateral epicondyle of the humerus. Okay, one more time with a better view, I think this time. The Anconeus takes its origin here, posterior to the lateral epicondyle of the humerus. It's a very small muscle, and it gets inserted into the superior part of the posterior surface of the ulna, and as well as into the lateral surface of the olecranon process here. So it gets inserted into the lateral surface of the olecranon process here, as well as into the superior part of the posterior surface of ulna. Now the Anconeus is supplied by the radial nerve. Okay, so here you can see the Anconeus here. So it's originating just posterior to the lateral epicondyle of the humerus, and it gets inserted into the lateral aspect of the olecranon of the ulna, as well as into the superior part of the posterior surface of the ulna. Again, this is the Anconeus. Now this is supplied by the radial nerve, and its action is that it assists the triceps in extending the forearm. So it's not the main extensor of the elbow joint. It assists the triceps brachii muscle in bringing about extension at the elbow joint, extension of the forearm. This also stabilizes the elbow joint. The Anconeus also tenses the capsule of the elbow joint. So it prevents this capsule from being pinched during extension, right? So when the elbow joint extends, the Anconeus pulls on the capsule of the elbow joint so that it does not get pinched in between the bones. So before we finish, let's go over these muscles just very briefly one more time. You have the flexor compartment, in which you have the biceps brachii, the coracobrachialis, and the brachialis muscle. So this is the biceps brachii. It has two heads. You have a long head and a short head, and it gets inserted into the radial tuberosity and also gives off an aponeurosis, which is known as the bicipital aponeurosis. It brings about flexion at the elbow joint and supination of the forearm. The short head of the biceps brachii prevents dislocation of the humerus at the glenohumeral joint. The other muscle that we talked about is the brachialis. So this is the brachialis. It is the main flexor of the elbow joint, and this brings about flexion at the elbow joint regardless of the position of the forearm. Whether it's pronated or supinated, the brachialis is the workhorse of flexion at the elbow joint. The third muscle is the coracobrachialis muscle here, and this also originates from the tip of the coracoid process. This flexes and adducts the arm at the shoulder joint, and along with the deltoid and triceps, it acts as a shunt muscle. And then in the posterior compartment, or in the extensor compartment, we have the two muscles, the triceps brachii and the anconeus. The main extensor is the triceps. It has three heads, a long head, a lateral head, and a medial head. And the anconeus is a small triangular muscle which assists the triceps in bringing about extension at the elbow joint, and it also prevents the pinching of the capsule of the shoulder joint by pulling the capsule of the elbow joint, by pulling it away from the bones during extension. That's it. Thank you very much.